Top 10 striking images that show COVID-19's impact on the world. Great Mosque in Kaaba in Mecca, Saudi Arabia. Chances are, regardless of whether you're not an individual from the Islamic religion, you are aware of the Great Mosque in Kaaba in Mecca, Saudi Arabia. It's the site of the Hajj, a journey that each Muslim must do in any event once in their lives in the event that they can do as such. The site regularly observes upwards of 5 million individuals during the Dhu al-Hijjah on the Islamic schedule. In 2020, it falls between July 22nd and August 19th in 2020, and on the off chance that the world comes back to any similarity to commonality by at that point, a huge number of individuals will be seen visiting the sacred site. This picture was taken on March 5th, and while that's not a date of any particular significance on the Islamic calendar, the Great Mosque typically sees thousands of visitors on any given day. The reason it was empty was due to the government's order that it be completely cleaned and sanitized for fear of spreading COVID-19. It opened the next day, but still saw far fewer visitors than normal. One reason the numbers were low was because the kingdom banned foreign visitors from entering the country on February 27. Beirut's Corniche Promenade in Lebanon. In the Lebanese city of Beirut, the Corniche Promenade stands as one of the top tourist destinations. There is a seaside promenade lined with palm trees and a beautiful view of the sea, where millions of visitors and locals can be seen enjoying the area throughout the year. Typically, the site is bustling with activity, with everything from people going on walking tours to visiting the local restaurants, but wasn't spared from the outbreak. And throughout the month of March and into April, Corniche Promenade has been a ghost town. This photograph taken by Mohammed Izakir shows the popular promenade completely devoid of human activity of any kind. Gone are the joggers, the walkers, the buskers, the famous pushcart vendors, and everyone else who would normally be seen on an otherwise beautiful day. The atypical shot of Corniche Promenade is the result of a government-mandated curfew, leaving many on lockdown within their homes. Sites like this are common all over the world as the COVID-19 crisis worsens, and this is just one of many similar images found all over the internet. Social distancing in Colombo, Sri Lanka. While the year 2020 may go down in history as being the one where a global pandemic swept across the globe, more people will likely think back on it with two words: social distancing. That's a term few had ever heard or considered using outside of the occasional introvert, but with COVID-19 spreading exponentially throughout global populations, social distancing became the norm. Societies, where people typically greeted one another with a hearty handshake or a kiss on each cheek, find themselves standing as far from one another as possible. This picture was taken in Sri Lanka by Dinu Kalyanawata outside a grocery store in Colombo. The people in the picture can be seen wearing masks and are standing approximately 1 meter apart. Most governments and the WHO are telling people to double that distance, but it's not always possible, leaving many in unsafe, yet desperately in need of supplies. Sri Lanka placed a curfew on its citizens prior to this photograph but relaxed it for a short time following a lull in newly reported cases. Mobile morgues in refrigerated trucks holding bodies in New York City. One scene nobody wants to be reminded of when thinking back on this crisis years from now is any that shows the toll the virus has taken on the people. Some of the hardest hit cities quickly learned that there wasn't just going to be a lack of hospital beds for the sick, there was also going to be a burden on morgues, coroners, and morticians. Everyone was so focused on the need for ventilators and hospital beds, few thought of what to do when the bodies began piling up. Fortunately, there were some who planned ahead. And that brings us to the picture featured here. This shot, taken by John Minchillo, shows bodies being loaded into refrigerated trucks outside a New York City hospital. NYC was one of the hardest-hit American cities in the early days of the crisis, and its hospitals quickly reached capacity on a number of services, which include the storage of the dead. The Brooklyn Hospital is one of many that have turned to such measures to store bodies, and the city has many. By April 8, more than 4,000 people died in New York City alone. Quarantined Italians singing together from their balconies. Soon after, China began implementing massive quarantine measures in Wuhan and other areas. The numbers being reported from the country showed a decline in cases and deaths. As those numbers began falling, they skyrocketed in places like Italy, which was one of the hardest-hit nations outside of China throughout the month of March, as social distancing became the norm in Italy. Its citizens found themselves isolated in their homes with little to do other than worry about what was happening in the hospitals and just outside their doors. In an attempt to combat the isolation and sense of dread many were experiencing, people all over the nation went to their balconies and began making music with one another. These musical flash mobs came together all over Italy, and on March 13, people all over the country went to their balconies to collectively sing the national anthem, Inno di Mameli, in a show of unity during the crisis. This picture taken by Miro Cinquetti shows a woman singing from her balcony, and if you haven't seen this one, there are thousands of photographs and videos of people singing to and with one another all over the internet. Dr. Li Wenlang's selfie from his hospital bed shortly before succumbing to COVID-19. COVID-19 has affected millions of people all over the world, but the most threatened group isn't the elderly and immunocompromised, it's the hospital workers who fight against the virus every day. All over the world, doctors, nurses, and other healthcare workers spend long days and even longer nights tending to the sick and dying with little to no personal protective equipment keeping him safe. One of the first doctors to fall to the disease, though not the first, and sadly, not the last, was Dr. Li Wenliang of Wuhan, China. Dr. Li was the whistleblower who sounded the initial alarm over a virus he had been observing that was similar to SARS. He was admonished by the Communist Party of China for making false comments on the internet. After contracting the virus he was fighting against, he took this photo from his hospital bed. He died on February 7, and this photograph went viral. Shortly after his death, the Communist Party of China issued a solemn apology for its admonishment of Dr. Li, though, by that time, the virus had spread outside of the country's borders. Russian cargo plane filled with supplies lands in the USA. As the United States government began to take the impending threat of COVID-19 seriously, it became apparent that personal protective equipment and ventilators were going to be in short supply. Stories of government stockpiles containing thousands of unusable ventilators due to maintenance contract expirations and warnings by officials to limit PPE to people who were showing symptoms began popping up all over the internet. Governors were set to bid against one another for equipment from suppliers, and some hospital workers were forced to reuse masks for up to a week at a time. Supplies were a problem, but some countries that weren't initially hit as hard as the United States did what they could to help. Russia filled a plane with supplies and sent them to the United States, which resulted in this photograph that circulated online for weeks. The aircraft was sent to the States following a one-on-one phone call between both nations' leaders. President Putin made the gesture with the consideration that should the US see a drop in cases while Russia finds itself dealing with a rise, the States will reciprocate if need be. Homeless in Las Vegas sleeping in social distancing grids. During a pandemic where governments are telling all of their citizens to self-isolate themselves in their homes, it quickly became apparent that there was a sizable population that couldn't follow that guidance. The homeless are at greater risk of catching their disease. But that's not solely the result of their having to sleep outside, it's mostly due to their close proximity with one another. whether they are on the streets or in shelters. Homeless people often find themselves stacked closely with one another, and that makes them susceptible to COVID-19, and it also makes it more likely that they will infect others. Exponential infection is one of the greatest concerns where COVID-19 is concerned, and in cities like Las Vegas, the way the city has had to deal with it made international news. Shelters were forced to close amidst the crisis, leaving as many as 500 on the streets. The city painted grids on the upper parking lot of the Cashman Center, with each box being meant as a place for one person each to sleep. Unfortunately, all good intentions being what they are, people online pointed out that the squares were too close together, negating the need for social distancing, which further spread the image to others as it became viral. Healthcare workers' faces after working with COVID-19 patients for days. A term hardly any individuals outside of the medicinal services industry heard before the emergency, N95, has become one nearly everybody around the globe presently knows. N95 covers a powerful dispensable veil fit for halting the spread of COVID-19 and numerous other airborne pathogens, which is one reason they immediately got fundamental for the world's medicinal services laborers. Sadly, they got increasingly hard to track down as the infection spread, which is the reason such a large number of specialists and medical caretakers ended up reusing them for any longer than they typically would have. Supply gives aside, N95 covers function admirably in light of the fact that they sit cozily on the face, and aren't the most agreeable things to wear for expanded time frames. During the time of March, individuals started sharing photographs of what they resembled in the wake of working for a considerable length of time and days while wearing the veils. Appearances wounded around the eyes and mouth turned into a typical sight as increasingly more social insurance laborers participate with their own shots. The photographs don't simply show wounded and tired individuals, they show the people dealing with the cutting edges to battle the ailment, a significant number of whom worked for a long 12, 18, and 24-hour shifts. USNS Comfort and the Statue of Liberty. Hospital beds, or more accurately, the lack of hospital beds became a problem shortly after COVID-19 reached the United States. It makes sense, as hospitals aren't in the business of handling a global epidemic, they're there to treat and care for patients under normal operating conditions. That works just fine when the world isn't undergoing a pandemic, but in cities like New York City and Los Angeles, a shortage of hospital beds due to the influx of COVID-19 patients caused two distinct problems. There weren't enough beds for COVID-19 patients, and there were almost no beds available to people suffering from everything else. People needing surgery, chemo treatment, and every other issue folks go to the hospital for were running into a lack of capacity in treating them. To combat the problem, the USN sent two ships, the USNS Comfort and USNS Mercy, to New York City and Los Angeles, respectively. Both vessels were meant to ease the burden by providing 1,000 hospital beds for patients not suffering from COVID-19, though since they have arrived, the USNS Comfort has taken on patients suffering from the disease. Shots like this one showing the Statue of Liberty in the foreground of the USNS Comfort spread all over the internet as it approached the port. The arrival indicated a show of support and a sign of hope in the days to come.